Welcome to Red Talk, this issue of Red Talk, which we dedicate to COVID-19. Today we're with Carl, a colleague of mine who is based in Fiji. So he also works for the International Federation of Red Cross and Red Crescent Societies. And he's just gotten up. It's only 7 o'clock in the morning in Fiji. And Carl, could you start with telling us a little bit about your daily life in Fiji and your work for the International Federation over there?
Yeah, good morning, Anne, from Fiji at least. I'm just sitting here on the terrace. We have a sunny, bright morning, no wind inside. We had a strong cyclone hitting us a few days ago, but no sign of that now. So, my name is Carl Gustav. I am a communications manager for IFRC, based in the Pacific. In our cluster office, we cover and support 14 countries in this region. To the south, we have New Zealand and Australia. And in the Pacific Ocean, we have 12 countries from Palau, via Solomon, Vanuatu, all the way out to Cook Islands. So we are covering quite a large area. It's 30 square kilometers of water with a lot of distance between the countries.
So today, the reason why you're with us is that we want to talk about a situation that is quite, let's say, quite concerning when a cyclone hits in the middle of a pandemic. And that's exactly what happened to Vanuatu, which was the hardest hit, if I understand well, last week on Monday by Cyclone Harold. And you've seen quite a lot of devastation there. And I wanted to ask you how you deal with this in a time of pandemic and what your main concerns are at the moment.
Yeah, well, so the normal situation in the Pacific is that communication is it's not very easy. We have many power shortages. We have not that many are able to communicate via social media and so on. So, of course, when we have COVID-19 pandemic, and we are very concerned that it will evolve in the Pacific too, we need to get out with messaging, and we need to reach as many people as possible, and that can be very
no communications, yeah.
Hard work, yeah. So and when we have a cyclone Harold, like we have had during the last week, of course it makes the situation even more complicated. Even though not that many of the Pacific countries, they have positive COVID-19 cases. We are taking very strong measures, and we have implemented a lot of restrictions throughout the Pacific. We have curfews here in Fiji, where I am. So we are not allowed to leave our houses in the evening and until early morning. We have military in the street. We have police officers at checkpoints and so on. So that makes it very difficult to reach so many people as possible, and also to respond when we have a cyclone Harold coming in.
Can you tell us a bit more how the situation is in Vanuatu nowadays, a few days after the cyclone hit very hard? How are people coping? Are they in evacuation centers? Have their crops, their livelihood been affected? Can you tell us a little bit what the priorities are for the IFRC and the Red Cross at the moment?
Yeah, so when Cyclone Harold hit, it was mainly the northern part of Vanuatu. We saw a lot of havoc. There was a lot of damages in some parts of that part of Vanuatu. 100% of houses and crops, they are destroyed. So people have lost their livelihood. About half of the population, they are affected by Cyclone Harold. Another thing is that we lost communications with our volunteers and staff in the region because it just went down, power was cut, so on. So for the last few days, we have working very hard to establish communications again, to assess the affected areas, to see and identify who needs our help the most. Because of the inter-island transport restrictions, it has been quite a big work for our logistics to find ways to transport all the non-food items and shelter kit and so on to the affected areas. So they have been working night and day, I would say, to get the vessels loaded and get them into that part of Vanuatu.
So have many people lost their homes? How can we imagine the situation nowadays? Are many people in evacuation centers? And how do you deal with the lockdown and these restriction measures when you're in such a situation responding to a hurricane?
Yeah, exactly. So when we look at Vanuatu, many of the people living in the northern island, they don't have solid structures to live in. So the houses in that area, they're very vulnerable to cyclones. So that also means that where they can seek shelter, that is basically schools, police stations, and so on. So they cannot get into their basement or a safe zone in the house and so on. So that also makes our messaging on COVID-19, physical social distancing, a little bit difficult nowadays. So if you can imagine all the villages in that area, they're damaged. They are just totally hammered. And people are cramping together in evacuation centers. That is quite a complicated operation to handle both COVID-19 measures and so on, and having this cyclone to respond to.
Do you manage to a certain extent, or is it that when you have to respond to such a life-threatening situation as a cyclone, COVID-19 is not the main priority? How do you deal with this tension between those two priorities?
Yeah, so this is a new situation. It's not new to Vanuatu to be exposed to a cyclone. Vanuatu is the most disaster-prone country in the world. So this is very experienced people. It's a strong people. They know what to do in situations like this, and we don't have any casualties, at least not confirmed from our side yet. So that says something about how people in this area they respond to this. So the first responders in a situation like this is not the Red Cross staff as such. It's the people on the ground. It's the population themselves. So we try to train volunteers in those areas the best we can, of course. But the first responders are people living in those islands, and they are coping quite well.
Yeah, Carl, I just wanted to have a little break to thank all the people who've joined us, who are listening to us, and they're really from a whole array of countries: Qatar, Colombia, Nigeria, Cameroon, Ghana, Italy, Malawi. So quite a few people are listening to us, and I'm curious when I hear you say that the first responders are the people, because indeed they've already had a cyclone not so many years ago. So are they aware then of the COVID-19 restrictions, and what's the degree of public awareness? Are people really worried about COVID-19 in Vanuatu, or is it rather something that they can't really focus on because there are other more important issues? Are they aware about all these restrictions that they should follow to prevent the disease from spreading?
Yeah, so what we have done, like in many other countries where Red Cross are doing messaging on COVID-19, is that we have translated all the messaging into the national traditional languages, and we have tried to get the message out there. And we use different channels for doing so. Of course, we have social media. but not so many people are on social media. So we are trying to reach as much people as possible through radio, which is used all over the Pacific. But one of the main things are what we call the coconut wireless, which is spreading of messages through mouth to mouth, so to speak. So if we can reach out to churches, for instance, to government officials and so on, and let them spread the messages to the people in some of the remote islands and so on, then that is the most effective way. We have also seen in Solomons that we have had staff and volunteers actually sailing around out to some remote islands and speaking into megaphones from one island to another island. And they, of course, been careful they've been very careful not to get out of the boat and into those islands, because they could spread the virus if it was so.
So you would say there's a big amount of awareness and care.
Oh yes, yeah. So like I said earlier on, the people out here, we're living in one of the most disaster-prone areas in the world. So people are, of course, listening to whatever officials and so on they tell them, and we're taking the measures very seriously. In Fiji, where I am, for instance, we are very dependent on the tourist industry. So we have a population in Fiji with less than 1 million people living here, and we have tourists coming in at great numbers, more than 1 million every year, and from one day to another, we don't see any tourists here at all. So that means that 40% of the GDP is just gone. So of course that is a very new situation for a country like Fiji.
So it might lead to social tensions, a lack of resources for people to get by every day.
Exactly, and so that since we don't have so many positive cases in Fiji, you could say that the COVID-19 problem itself, in terms of health, is not so serious like in Italy, for instance, where it's extreme. Yes. But we see a lot of other side effects of the cure. So Fiji is also one of the countries where we experience a lot of domestic violence. And when you stress a population with unemployment and you cannot leave the house and so on, where are we going to get an income from the next half year or 1 year? Then we are, of course, we are worried that we will see an increase of domestic violence and even child abuse and so on.
That you're ready to respond to? Sorry. Is that something that you're ready to respond to with your volunteers? Do they have that sort of training? Is that something that's an everyday kind of service offered by the Red Cross?
It is in many areas, and that is also part of our COVID-19 messaging is to tell people how to act in situations like this, where to seek help and counseling and so on.
And you said that the people are very resilient, and indeed it's a very disaster-prone area. You've done a lot also to prepare, the IFRC and other organizations are doing a lot to prepare countries for climate-connected disasters. But still, I guess there's also a need for external help when you get hit by cyclone. Because of the lockdown, has that been a problem? Maybe it's a bit early to ask, but has that been a problem, or do you envisage that it might be a problem that equipment couldn't come in? We've seen that masks are missing, etc., in many countries. So is that a problem?
It is a huge issue in this region. Like I said, we are covering a very large area of primarily ocean. 30 square kilometers of ocean, and we are just small dots in that great ocean, Pacific Ocean.
Yeah.
So of course, transportation between the islands and air freight and so on it's a huge issue. So we have logistics working around the clock to secure that we can get all the equipment and relief and so on from country to country. So that's a big challenge.
Yeah, because
And
you
that
see
is
that many
something
countries around the world are struggling. Yeah.
So that is one of the main focuses from IFRC in the cluster office in Fiji.
I'd like to go back, Carl, if you don't mind, to the issue of domestic violence, because we've got someone asking on Facebook how we're protecting children and what the IFRC and the Red Cross are doing to protect children in those situations. Under lockdown, they might not have access to social services, etc. So how do volunteers tackle this?
Yeah, that's a really good question. So we also have officers that are trained in child protection and how to help people, to let them seek counsel and let them look after each other and so on. So if we have people who experience child abuse or something like that, we want to let people know that, of course, this is not okay, but also where they can seek help and counseling and so on.
Yeah, because children don't go to school. Often the school has this kind of, protective layer. And indeed, I mean, it's not only in Fiji and Vanuatu. We've seen this in many countries in which we are now working in this COVID-19 context. My other question, Carl, would be, I don't know much, to be honest, about the healthcare system and the preparedness of the countries in which you're active. What would you say? I mean, I'm happy to hear that there are not too many confirmed cases in Vanuatu. I've heard there are a few in Fiji. How are these countries prepared, and what would they need most, maybe, to beef up their preparedness?
Yeah, well, that is also one of the main issues that the government are trying that they're taking very, very serious. So healthcare in the Pacific is to be honest, is barely on a level where we can handle the health of the population itself. So in regards to hospitals and health centers and so on, it's something that we really need to be careful that we don't put too much pressure on those facilities and the health staff, because it is scarce. So that is also one of the reasons why the restrictions are so tough in the Pacific. Yeah. So of course we need if we see an explosion of COVID-19 cases, of course it will be a huge problem for the countries out here to respond to that.
Yeah, and we have also someone who's watching us who's asking. You said that the population in Fiji, in Vanuatu, in all the Pacific islands, because they are so disaster prone, know a lot about how to respond, how to prepare, how to help others, etc. So is that due to lots of the training that you've done, that you've implemented? And what's then the role of organizations like the Red Cross? When people are so resilient, so well prepared. Where do you see added value, and where can you still help, basically?
Yeah, exactly. So every Pacific Islander, they know basically how to react when a cyclone hits the island. So that's the part of growing up in this area, that you know that this can happen, and it happens almost every year, that we have strong winds, storms, cyclones, and so on. In Vanuatu, we even have volcanoes and so on. We can have earthquakes also. So that is a part of life in this area, and of course that makes a huge difference in terms of of how. Sorry, I'm getting the sun in my eye.
Yeah.
So I'm just moving a little bit to a different spot over here. So like I said, people are very resilient in this part of the world. But of course, Red Cross, we can help organize people. We can bring resources around in the countries. We can bring trainers to help people to be trained in first aid, which is a huge thing that we help people with. And also we are one of the leading forces in shelter clusters out here. So when we experience cyclones like this, people know how to rebuild their houses and so on. And yeah, so we are helping, assisting in many different ways.
Okay, there was a little problem with your sound, Carl. I don't know if it's maybe because you've moved that the Wi-Fi is less strong.
Oh,
Let's continue and see if it's better. Okay, I can hear you better now. So yeah, I'm also very curious about, and I've heard a lot about climate change, adaptation, and how countries like the Pacific Islands that are already, and we see it with all these, you say that they are ready to respond. They live with cyclones already for such a long time, so they're already living the effects of climate change. How do you basically, do you think that you're going to be able to continue all these activities with COVID-19 if COVID-19 hits and the economy, really gets hit hard? There's no tourism anymore, etc. Will people still have the energy even to look into that, to get themselves trained, or will like everybody's now worried basically that climate change might not be taken so seriously anymore because COVID-19 takes over all the funding and all the attention of the community?
Yeah, that's a very good question. What we see is that where I am in Fiji, Fiji is a food secure country. So that's like a very good start for a country experiencing a crisis like this, and it counts for many of the countries in this region. And we also see that I mean, we are sure that people in this region will get through this, and we will get through it, and we will recover. But of course, it's going to be some tough times. But I'm sure that people in the Pacific, because that's the way they are raised, they will get together and they will recover in the smaller communities. They will look after each other and so on. So, and they will continue support Red Cross and other organizations and continue to be organized and trained and so on. So that is you can say that we're talking about flattening the curve. In other manners. Here we see a steep curve of people who are willing to help out and get the training that we are providing so that they can help in their communities and so on.
Yeah, and be prepared and adopt climate adaptive measures.
Exactly. So we are already adopting climate change measures, and we will continue to do so, of course. But now we have a different situation with the COVID-19, and people are adapting to that very well too.
Yeah. So can you tell us what you will need most in those evacuation centers that you mentioned? People are being evacuated. That's something that rings alarm bells in terms of groups of people, etc. Maybe, I don't know, lack of equipment, basic hygiene. What do you need most? If you could ask now somebody who could fund your response, what do you need most?
Yeah, what we are providing at the moment, and what we're sailing to the northern part of Vanuatu, for instance, that is shelter kits, so that people, they can start rebuilding their houses or shelters at least. Hygiene kits, also very, very important, especially in times like this. Also, we are providing kitchen kit too. As I said, many of the people in that part of Vanuatu, they have lost their houses, they have lost their crops, and so on. So those things are extremely important, and also communications. We are struggling with communications too. So we are also trying to re-establish communications, bringing in satellite phones and so on. See if we can reach people via radio and other things.
And are you concerned that these things might not arrive because of the communications problem, the transportation problem, or just because everybody's now funding COVID-19 and maybe this might not arrive because of the lockdown and the restrictions?
Well, as we've talked about a few times, Red Cross in the different countries, they're always very well prepared to situations like this. So we have a lot of things in stock. And we have them spread around the countries, so they are easy to get to and easy to distribute. Of course, in this situation, it's not that easy. We have some travel restrictions. They are lifted for us, so that we can provide the kind of help. So we're not so worried that we won't have enough to in stock to help these people, but what is an issue and a challenge is to get it out there in time. So we are going to get all the things out there, but it might take 1 or 2 weeks before we have identified the people who needs this, and also to get it out there.
Yeah, because I guess there are groups, vulnerable groups that are very difficult to access also on an island like Vanuatu.
Yeah. They are spread over hundreds of islands. So yeah, that's difficult.
Yeah. We're also thinking, since we're talking about COVID-19 now, there was a lot of hope that Ebola in DRC might be declared over, and so our hearts are with all our volunteers who've been working against the clock, to try and fight Ebola. It's a really it's very concerning and it's very disappointing, I think, for all of us. So a big hello to them, lots of love to them, and again, it shows that we're a family. We're all trying to tackle, these diseases, responses all over the world. Do you want to say anything, Carl, about the situation with regard to pandemics, regard to Ebola, what your wishes are, how you see the situation evolve in your area, the area in which you're active?
Yeah, so I've been in this part of the world for 1.5 years now. And I must say that I am very, very impressed. Though we are divided by thousands of kilometers of water, there are a great amount of solidarity between the Red Cross societies in the different countries. We are communicating with each other on a daily basis, even sometimes hourly. I am in close contact with the communications officers that I am supporting every day, and there's a lot of good energy. They are supporting each other in the best way they can. They are exchanging the skills that they have, the experiences that they have, what works, what does not work. If we have something that works in Palau, let's try to see if that is what they need in Tonga, for instance. So we are really trying to help each other, even though we are divided by lots of water. And we are also getting a lot of support from Asia Pacific and Geneva too. Our colleagues and headquarters in those countries, Switzerland and Malaysia. So we are very, very happy with that. So I must say, this is despite the serious and of this situation, we can see that things are actually working, and we are battling 2 disasters at once, and we can do it. So we are so happy that we have been so well prepared. We have had volunteers that we couldn't reach for several days in the northern Vanuatu, but even though we've remained calm because we knew that they were well trained. And when we saw the pictures coming out from Vanuatu, we could see volunteers lifting the vulnerable, the elderly into shelters and so on. And they were wearing the Red Cross vests and everything. So they were really brave. They were doing exactly what they were supposed to, because they are raised like that, but also because we have helped them become organized and so they know how to respond in situations like this.
And I would like to take the opportunity also to thank all these volunteers, these very resilient people in the islands in which you're active, because without them, we couldn't do anything, especially in those remote areas, as you said, when communications are lost, when transportation roads are broken. Everything depends on them. And we see it in the COVID-19 context too, that the volunteers, they are there, they're on the ground, they're ready to...
Exactly.
They're prepared, yeah.
And one more thing that we have experienced here, and that happens in every great disaster that we experience out here, is that the collaboration with other NGOs and government officials like National Disaster Management and so on is also working quite well. So we have risk comps groups who have a task force in some countries, IFSC or Red Cross, they're leading them. In other countries, it's the WHO and so on. So people are really coming together and working side by side in terms of battling this.
Yeah. So Carl, unless there's anything else that you really want to tell our audience, I think we could wrap up here by thanking all our volunteers, again, flagging that we are all in this together, be it hurricanes, be it COVID-19, and that this broadcast goes to our volunteers. And I would also like to wish a happy Easter to those who are celebrating, probably under lockdown, most of them. Carl, is there anything else you would like to tell our audience?
Yeah, I will just say to my colleagues and the volunteers from Red Cross spread around the world that we are watching you, we are thinking of you, and especially in Africa, where I have spent a lot of years living and working. We are praying for you. We're hoping the best that you will get through this crisis, and keep up the good work.
And I want to tell you the same, Carl, keep up the good work. And we really want to stay tuned on how the situation is developing in Vanuatu, Fiji, and the other islands. We can talk again if you wish. We wish you all the best. And again, thank you to our heroes out there, those who have been lost for a few days on the ground because you couldn't even talk to them anymore. They are really, I think they show the spirit of the Red Cross, and thanks a lot and good luck.
Exactly. Thank you very much, Anne.
Bye. Have a good day.